Good morning. This is Jo Alch. I am the owner and director of nursing of Acappella. We're here today with our Acappella podcast. I've got an awesome guest. Her name is Erica Moore, and she is our administrative nurse at Acappella. Has been with us for about 8 years. Welcome, Erica.
Thank you very much.
We are talking about coronavirus today. I just fortunate got to come back from being on vacation. Was on a flight yesterday, and half of the flight had on masks. And anyway, so it's just a good subject. Everything's going on in the news about coronavirus. Everybody wants to take precautions. We're a little nervous. Everybody's a little nervous and watching the news. So let's talk about coronavirus. Let's talk about what is going on, what our concerns should be. So let's start at the very beginning. So tell me, Erica, how did this start? Talk about coronavirus, how it got started.
Well, from everything that I've learned, it's a virus that came from animals, transmitted to humans, and it came from China at this point, from what we know. And now that it's transmitted from animals to humans, now it is being spread between humans. But it did originate from animals to humans. And so you're right. I mean, like I was just in CVS yesterday for a patient, and they were completely out of masks, and they were completely out of hand sanitizer. And it's just, if you look on Amazon, masks are outrageously expensive, hand sanitizer is expensive. So yeah, people are trying to stock up, and it's causing, especially now, I think, watching the news and watching media, when it was over in China, maybe people weren't as concerned, but now that it's made land in the United States, and it's in different states, and it actually is here in Texas now, people are just, they're getting more and more anxious because it is here, it's in our backyard, and so people are taking precautions.
So let's talk about, how many people have been diagnosed with coronavirus worldwide?
Right now, we're looking at about 87,000 people.
And I looked up, 87,000 people are in the age range of 30 to 79. It looked like as of February 11th, it was 72,000. We're up a little bit. Of those, only 8% were 20 or younger.
Right.
So tell me, it looks like it's really more the senior community that is going to be more affected by the coronavirus.
It is going to be, the major population is the senior community, but that is because it's not really based on age. It's going to be based on whether or not their immune system is compromised. And so even that younger population that we're seeing that's being diagnosed with it is because they have compromised immune systems, and that's how that virus is getting into them and having an effect on them. Your normal, everyday walking around healthy adult or healthy person isn't at as much risk as your older adult or your immunocompromised person. So yeah, there is a much larger age range with the older geriatric population because they do have compromised immune systems just on a daily basis.
So if someone thinks they have the coronavirus or they think that they have symptoms, what are the symptoms that are related to the coronavirus?
Crazy, there's not that many. There's about 3 that they're looking for. They're looking for shortness of breath, fever, and a cough. And it's not when you compare those symptoms to what you might have with the flu, there's just those three that they're looking for right now. And as they learn more about the coronavirus, that may change. But right now, with what we know and what's being published by the World Health Organization and by the CDC, it's fever, cough, and shortness of breath. And that may be a contributing factor as to why it's not diagnosed as quickly, because it's just those three.
Well, and back a few months ago, and I don't know if you remember, I wound up having this horrible cough. My lungs
Right.
were clear. And I wound up having whooping cough, which was the craziest thing. I don't know how I caught it, but it was like 6 weeks. I did cough for about 6 weeks, and I was feeling pretty bad. But antibiotics, cough syrup did the trick. So if somebody has these symptoms, fever, cough, shortness of breath, certainly, do they need to go to the emergency room? Do they need to call their doctor? What would you recommend they do?
Well, I would say the first thing that they need to do is make sure that they're wearing a mask. So in the event, but they need to look at their surroundings. Have they been anywhere that they could have been exposed? You have to have an exposure to it. It's not just, flying in. But I would say it's not really necessary to go to the emergency room and overpower our emergency rooms. But they definitely need to call their doctor and say, hey, maybe I was on a flight and now I'm having these symptoms. I've had them for 2 days now. And, what should I do? What would you have me do? They definitely probably need to go ahead and proactively put a mask on, make sure that they're washing their hands really good with soap and water. In between washes, hand sanitizer. And make sure that they stay away from people who might be in an immunocompromised situation. So if you think that you might have been exposed, stay away from your grandmother or that 6-month-old baby. Don't go around those people, because that's how those people with the suppressed immune systems are getting exposed to it. But it's definitely. There's a larger incidence of flu than there is the coronavirus. It's just that we don't know a lot about the coronavirus, and I think that's where the fear is coming from.
It's just that fear of the unknown.
Absolutely.
So I know they're looking at people that have traveled. Those are the ones that are most susceptible, that are bringing that over to the United States. So
Right.
Countries to be concerned is avoid non-essential travel are China,
Right.
Italy, South Korea. We have a patient right now who has in a facility that had a visitor from another country, and the facility took awesome precautions. Very, very insightful on how they protected. There's nothing to worry about. She showed no symptoms, the family member, but then
In your hands. There are times when you may have normally gone to hand sanitizer. Washing your hands with soap and water, it can't be replaced. Making sure that our clients are diligent, reminding them to wash their hands with soap and water. Thinking about where they're going and where their exposure is. If you're in large groups of people, you're not going to know what all of those people have been exposed to. So it's just, if you have to cough, they're saying the recommendation right now is to make sure that you're coughing into your elbow so that when you cough, that's not going out into the room. And then, just paying attention to if there's a cough, fever, with the shortness of breath, then those things, are going to be reason to call your physician and say, hey, I've got these things going on. And then knowing where you've been, knowing who you've been around. But just the really good diligence is going to be making sure that you wash your hands, making sure that your areas are clean, Lysol wipes, making sure things are wiped down, and just the diligence that we should already be doing, and just making sure that we're doing those things.
And, simple things like making sure the trash is taken out, and
Absolutely.
The kitchen counters are clean. And when you're doing incontinent care, put gloves on, and don't use the same gloves that you've worked on personal care with kitchen and meal preparation.
Absolutely.
Just because you're wearing gloves, they can collect germs as well. And so be super diligent about that. So anyway, that's I know there is a nursing home now in Seattle, or just outside of Seattle, Washington. It's the Life Care Center of Kirkland. 9 residents have tested positive for coronavirus. And so I just look at, as a healthcare professional and doing private duty, how can we train our staff? How can we make sure our staff is safe? And we're sending them out. We want to keep them safe as well as our patients. But this nursing home, this article about this nursing home of 108 residents, 50 are showing signs of this virus. And it looks like the employee that brought this in was traveling. So it's so important, if we're doing any traveling and you do have symptoms, get those checked out or stay home.
Right.
Stay home.
And I would say one of those things is if a person has traveled, even if you don't have symptoms, take precautions, because you do have that potential to transmit something that you may not be aware of, because maybe you're not showing symptoms yet. We don't really know what the incubation period is. We don't know what the lifespan is of the virus before you show symptoms, at least not that I have found yet. And I know that they're learning more and more every day about it, and I know the researchers are out there. But if you've traveled, or if you've been around someone who's traveled, if you're that person, make sure that you're being hyper diligent about personal care and being clean and wearing a mask. And then if you know someone who has traveled, then be that coach for them and say, hey, I know that you just got back from so-and-so. Go ahead and put a mask on. Go ahead and be super diligent about making sure that you get your hands washed, and making sure that that we just don't expose anyone, because our patients depend on us. Our patients and our clients depend on us. Our families depend on us to make sure that we're doing the right thing. Nurses didn't get to be one of the most respected professions in the world for no reason. And we have to be just hyper diligent about that.
And one thing, just simple, but washing hands, 20 seconds. I see people, I go to a restaurant and I'll run into the restroom and wash my hands. And I see people, so many, that are not washing their hands or not washing them correctly.
Right.
20 seconds. And you think about everything your hands touch all day long. The steering wheel, the opening a door just to go into an office,
Exactly.
moving a chair. You go to a restaurant, you move the chair to sit down. I mean, your hand is always touching something. So just be really diligent about that hand washing, which is the most important thing,
Right.
The way to prevent infection. So we're going to talk about you. Erica, you've been with us for 8 years at
Yes.
Acappella, do an outstanding job. And the pro and con of using Erica in the home at Acappella is that once Erica goes out to meet with the family, they don't want anybody else, because Erica is the unicorn, the private duty unicorn nurse, and you do such a great job. And I want to talk about families that want a private nurse in their home. You get it. I get it.
Right.
Not every nurse gets it. I would never be good in ICU. I would never be good in the ER, but I'm really good at that one-on-one care. That's what's so wonderful about nursing. It is so diverse. We can do so many things, but just because a nurse has a ton of experience, which you do, you're very educated, you're awesome, but you also understand that bedside and that importance of having that right personality at the bedside. So talk about, what is your key to success? What would you say? You do get compliments all the time, and you do a great job. What do you think it is that differentiates you from other nurses?
I actually get asked that a lot, and I'm really not sure. When I go into a client's home, I try to make sure that and it's just second nature to me. It's not, I don't have to think about it, but regardless of what their condition is, regardless of what we're doing in their home or what I'm doing in their presence, I always treat my client with respect. I never treat them as an invalid or that they're less than. I make sure that I give them the respect that they're due. I'm from the South. It's always, sir or ma'am or, Mr. Smith or Mrs. Smith, whatever their name is. I don't try to pretend like I'm their family because I am an employee and I'm there to work. And I make sure that I'm proactive. I don't, when I walk into a space, if I see something that needs to be done, I'm confident in my abilities. I'm confident in my nursing, that if I walk in and I see a deficiency, I gauge the situation, but I bring it to light. I say something. I try to bring it to light in a tactful manner, so as not to, make it a bad situation. But I want to make sure that in a private duty situation, you have families that they want that family member taken care of. And it's not because insurance says this is what we can do. It's because this is what we want done. And they may just want the benefit of knowing that nurse is in the home. Maybe they have staff that are making their meals. Maybe they have staff that's cleaning their house. And they just want to make sure that the nurse is there in the event something happens. There's such a wide range of what we do in the home, and it could be anywhere from complete and total care the entire time we're there, or it could be just the presence of knowing that a professional who knows what to do is there. And so it's respecting that. It's respecting whatever it is that they want and not saying, well, the rules say I have to do this, this, and this. It's honoring what they want, and that's what private duty gives the family and gives the client, is the ability to say, this is what I want. And of course, we're bound by the state. We definitely have rules that we have to follow. And as long as we have a physician that's giving us orders that we're able to, we have to have direction regardless of whether it's private duty or what. But we take most of our direction from our clients and our families, and we're able to give them the service that not only that they're paying for, but they want, and that they need. So.
Well, it's not a one-size-fits-all. Like, sometimes a physician may have patients that have hip surgery, and one's recovery time is going to be different than another. So it's not everybody reacts the same way.
Right.
So some people want that private nurse just for that peace of mind, like you say. I mean, we've had people that had surgery, and they say, when I wake up from surgery, I want to know that an RN or an LVN is right there at my side and asking those questions for me, for me, it's just putting myself in their shoes. I try to kind of read. You and I both have a good sense of discernment. I think that really helps as private duty nursing. You have to really see kind of the whole situation, the dynamics. We have some people that have the most immaculate homes. Well, do they want us in there propping our feet up, sticking our purse on the kitchen counter? I mean, it's just observing how do they live? How do they, what is their day to day? How can we be comfortable? We're guests in their home.
Right. And it's, to be a good private duty nurse, it's anticipation. It's being proactive. It's not waiting on the client to tell you every move to make, because they may not know every move to make, but that's why they're paying someone that's skilled and educated. The other benefit is going to be, I've got some clients that or families that I go to doctor's appointments with my clients, and it just makes a world of difference in communication, and just the care that we're able to get them. And I have one client right now that's not nonverbal, but just can't talk really well. And I went to a doctor's appointment with them recently, and they were so thankful that I was able to communicate just by by knowing this person and seeing them on a weekly basis, I was able to communicate what I know. And we were able to get some just amazing care set up for this person. And they were just extremely thankful. And the family was thankful. Not every person has family that's there to take care of them. Not every person has aunts and uncles or nieces and nephews or children. And so it's just them. And maybe they have some sort of insurance or they have the money to be able to pay for private care. And that's where we step in, and that's where we take care of them. And, we have patients that are clients that, we're their family. And we take care of them and we look out for them. At Christmas time, my patients that I see, I made blankets for them and took them to them. And they were it's just going that extra mile and making sure that they know that we're not there to just, make a paycheck, or, we really care about them and we're a part of their world and they're a part of ours.
And you can still make a paycheck but care about what
Right.
you're doing. And just giving 100%. And that's in all aspects of work. It's not just nursing. It's,
Right.
Even doctors, you hear, oh, he had no personality, or he wouldn't even look me in the eye. Well, it's important just in all fields, just be respectful, meet them where they are.
Absolutely.
Be there if they have a question. Be there to listen. It's just so important. Well, I am so excited that you've been here today, Erica, and just summing up back to the coronavirus. So the best prevention we're going to go over is avoid close contact with people who are sick, not just coronavirus or flu or bronchitis. Just stay away from people that are sick. Avoid touching your eyes, nose, and mouth. So, wash your hands. You don't, I heard something on the radio today. Right now, they're encouraging, instead of wearing contacts, wear glasses, because you don't have to put your fingers in your eyes.
Right.
Stay home when you're sick. So important. People are worried they're going to lose their jobs. They will not lose their job if they're positive for the coronavirus. They're not going to lose their job if they're sick. We don't want, employers don't want employees bringing illness to work. Cover your cough and sneeze with a tissue. And then throw the tissue in the trash, or use that elbow cough that we talked about that's so important. And then wash hands with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. If soap and water are not available, use alcohol-based hand sanitizer. Always wash hands with soap and water if hands are soiled in any way. So thank you so much. Let's all stay healthy. Have a great week, and see you soon.
Thank you so much.
Thank you, Erica.